welcome you back to our FACE seminar series today. With our presenter today is James Irlam from the Primary Healthcare Directorate. I've met and known James for quite a while, but I was also interested to see that it's now your 20-year anniversary with UCT and the Primary Healthcare Directorate.
That's right. Yes.
So James, my understanding is you also trained as in epidemiology, and then you did an additional master's in climate change and sustainable development.
That's correct. Yeah.
Yeah. So we very excited and to have you present today on the Planetary Health Report Card and in its implications for our faculty and also abroad, and how that might also impact how we think about how we train, how we conduct research, and how we engage in both academic and community spaces. So I think this is a highly relevant topic, and I'm glad that you are here today to share the latest iteration. But I understand you have been working on this process for quite some time over and I'm sure with each iteration there's fresh insights, new ideas, new possible strategies to help encourage and motivate colleagues to think differently about how we do things, so we can unlearn and relearn things. Yeah. Well, over to you, James. Yeah, thank you very much for being here. We look forward to your talk. So I'll switch off my camera and mic, but yeah, if colleagues along the way have questions, we can pop it in the chat. There's also in the chat, there's a email link to Jeroen Swart, as well as the links that you have shared to the report card. Thanks for doing that, James. Over to you.
Thank you, Klaus, and good afternoon, everyone. So as Klaus has mentioned, I've been working on this report card with a group of students since about August last year, and I'll just be reporting on some of the key findings and perhaps some implications for what it means for curriculum transformation, with some examples from faculties and medical schools around the world. I trust you can all see my presentation okay, and I'll begin then with the fact that on Earth Day, the 22nd of April, the Planetary Health Report Card, the 2022-2023 version was launched, and as you see from the little map there, that our UCT one was the first from the African continent. The report card is a student-led initiative that dates back to 2019. And so we're hoping that in time, we will be joined by others. So just by way of definition, what is planetary health? Well, the Planetary Health Alliance, which I will tell you a bit more about later, defines planetary health as a solutions-oriented transdisciplinary field and social movement that is focused on analyzing and addressing the impacts of human disruptions to Earth's natural systems, on human health and all life on Earth. And this definition is intentionally broad to encompass a multitude of ways that the environment can affect health, including climate change, pollution, shifts in biodiversity, land use changes, resource scarcity. And all of these have impacts on health. And one of the things that we do in our teaching is to help students understand these linkages between climate change and environmental degradation as amplifiers of environmental risks to health. So here we think of food and malnutrition, vector-borne diseases, mental illness, and excessive mortality due to heat and air pollution. And then paradoxically, healthcare delivery has a huge adverse impact on the environment and therefore on health. And if the healthcare system were a country, it's said that it would be the 5th largest carbon emitter in the world. So as the statement in the Planetary Health Report Card makes clear, that this is therefore an essential component of health professions education, especially since health professionals have such agency. They're trusted voices, and they are very close to the impacts of climate and environmental degradation on health. And also they have influence in their health institutions and in ministries of health where policies are being made around climate and health. So the report uses a metric-based data collection tool. It has 5 domains that you see there. This is just the snapshot of the UCT version, which you can access in more detail via the link in the chat. But the first domain there is around what does planetary health mean for our curriculum? What does it mean for our research? How can it be included in our community outreach and advocacy? How can we support student-led initiatives, given that this is an issue of growing concern for younger generations? And finally, and importantly, what does it mean for our campus operations and services? How do we embed it into our everyday practice? And so the grades that you see there are based on a subset of 23 report cards out of the 43 people we interviewed. 23 scored on the questions that were in the report card. And we had 9 departments represented. And you see the overall grade of C, or 43%, ranging from 54% for our curricula to only 20%, or D- for our support for student-led initiatives. You can see we've got some way to go, but we're not the worst. But amongst the 100+ cards that were completed this past year, but we're certainly far from the best. So the following slides will just summarize the key qualitative findings from the interviews that informed the grading. So in addition to scoring the card, comments were provided. And so we've summarized these comments. Firstly, around the curricula, the first domain, there was near unanimous agreement among interviewees that planetary health and sustainable healthcare are important, but that they're not taught and assessed and demonstrated enough. And as you see from the quote there, that an essential systems approach is generally lacking. And it's those big systems that we need to understand to make the connections between planetary health and what happens at the bedside and in the clinical encounter. So we see that also, in addition to the agreement that they're not taught and assessed enough, that there's growing awareness of sustainable clinical practice that's being spurred by these worldwide developments towards low carbon and climate resilient healthcare, as well as the curricular initiatives that I'm pleased to say are growing in leaps and bounds. So our interviewees in health and rehab sciences and public health and family medicine highlighted the need for transdisciplinary and interfaculty approaches to make sustainability a cross-cutting theme across all years, and for a decolonial perspective to be applied to community-based teaching and assessment, such as including community activists as educators, and community-based reflections on how to advocate for sustainable healthcare. That's the abbreviation, SH. And then how to integrate planetary health and sustainable healthcare into the primary healthcare approach and into the international classification of functioning in the rehab sciences with some of the specific suggestions, as well as into professional education in surgery and medicine and family medicine. Similarly, multidisciplinary educators in the preclinical years and in departments of surgery and medicine also called for sustainability to be embedded as a cross-cutting theme across all years and to include Indigenous perspectives on planetary health. And they also identified the need for more education and advocacy for sustainable clinical practice among our clinical educators and students. And The reuse of medical devices is something that I have been involved with some of the leaders in surgery to see if we can't reverse the Health Products Regulatory Authority ruling on single-use plastic devices that are hugely wasteful and expensive. And then interviews also offer their qualitative perceptions of what some of the barriers to integration of planetary health and sustainable healthcare could be. And they're summarized here. And in consistency with the literature around the world, curriculum overload, not having enough time, siloed learning were cited most often as barriers. And then our clinicians we interviewed spoke of how an ethic of sustainability may conflict with one's duty of care to the individual patient. So the idea of care at all costs, even if it's a huge environmental cost. And then also how shortages in the health system and cost cutting and going for the cheapest products might override concerns about what are the most environmentally sustainable products and services. Then moving on to the second domain, so that scored a D+. As you see, this was our community outreach and advocacy. And we found that although our students have many visits and workplaces in local communities, there's little advocacy and information sharing to protect community health from environmental and climate threats. We have in our faculty strategy goal 5 relating to social accountability, alliances and partnerships. And that goal is about enhancing excellent service delivery and other forms of social accountability to address health and its social and structural and social determinants. So we suggest that this goal within our strategy should encompass environmental accountability as well, and aiming at more community partnerships that address the environmental determinants of health. So the logo I put there is of the African Climate Alliance. That's a youth-led movement. We've had activists come and speak to our health in context classes, just relating their stories of how, in their view, climate is impacting our poorest communities and why this is a matter for a whole of society approach in which health professionals have a key role to play. And then our interview with the Shawco director, she spoke about using teachable moments to help Shawco volunteers reflect on healthcare sustainability challenges in practice, as they see it in communities affected by increasing extreme heat or drought or extreme weather events. So again, to connect the classroom learning with what is happening on the ground. And then we suggest that student health promotion projects could include more about the health impacts of climate and how to mitigate them by means of community-based interventions that have clear co-benefits. So that's benefits for both the climate and for people's health. And so popular ones around the world are promoting more active mobility, so getting people to walk and cycle more often, which obviously implies better urban design to make that safer and secure. Home food gardening to, again, get people active and lessening the carbon footprint of our food system, and healthier food, obviously. Renewable energy, we know all about that in South Africa and the move towards that thanks to Eskom and load shedding, but that obviously has massive climate environmental benefits, given that it's far lower polluting than our coal-fired power system. And then clean cooking technologies, so this refers to technologies in the home that don't produce the kind of indoor air pollution that open fires or paraffin burners that impact so many of our poorest communities. So there's good evidence to support all of these impacts, and so students should be and patients should be aware and educated about those. Then we included students in our interview team, and it was great to work with them. And when we interviewed some student leaders. We recognize that not enough is being done by far, and hence only a D- on this particular domain. And so our suggestions for increasing student involvement would be, for example, partnering with local environmental justice and student societies. We have the Green Campus Initiative, which hasn't been very active on health sciences in recent years, but we seem to be building good relations with the existing GCI. We need student advocates in our leadership for sustainability in our curricula, and so perhaps in the curriculum change work streams, we can consider how to include the student voice, as other faculties have done. And in our campus operations, how to promote water saving, energy saving, biodiversity across our campus. And I'll say more about that shortly. So you might be aware that UCT has an environmental sustainability strategy. We have a director, Manfred Brown, of environmental sustainability, and he was very helpful in helping us to compile the report card in this domain. So we know from our interview with him and his equivalent on Health Sciences Campus that we have this aim for a net zero carbon, water and waste to landfill campus. So that's an ambitious goal. Again, we're following best practice around the world in hospitals and educational institutions in doing that. And we have some wins in terms of waste recycling, so trying to improve the decade-long failure of waste recycling on campus, which is actually quite shocking for an institution like UCT. We have a horticulturalist who is using the opportunity created by the campus fire to improve biodiversity and landscaping across campus. I'm talking about the upper campus, but we've also seen some changes at Health Sciences. And then we have this intriguing possibility of this pilot orientation course on sustainability for all faculties. And at the moment, it's only offered to students in residence, but in the strategy, it speaks about this foundational literacy course. And so working with Mr. Brown, we've been able to consider our faculty as perhaps a pilot for that. And then I've also connected with the Interfaculty Research Community of Practice that's been developed under the banner of the Kusele Ikamva, or Sustainable Campus Initiative. This was established in 2021 to enhance environmental sustainability towards UCT's Vision 2030 and to support it with research evidence. We have groups like the African Climate Development Initiative and Future Water, which are already doing a lot of this research. And again, linking faculty of health science researchers into that community of practice and promoting involvement from our researchers in global partnerships and increasing funding opportunities for planetary health is a great opportunity. And we'll certainly see more of that in the coming months. Okay, so again, in summary, this is our report card. So the overall C rating, 43%, ranging from 20% for student-led initiatives to 54% for our planetary health curricula. In the next slides, I'm just going to highlight some of the key recommendations and examples from institutions around the world. So the good news is that we don't need to start from scratch in designing a planetary health curriculum. There are plenty of resources out there. Planetary Health Alliance has a whole database, and here in the report card are links to some of those, including this curriculum for the UK that's been recently published, and I'll show you that at the end. And then establishing learning objectives. So what I've done as part of my research is to see how the learning objectives of the International Consensus Statement around Education for Sustainable Healthcare might be adapted to our setting and might be linked to the AfriMed's key competencies and enabling competencies within our framework. So I'm talking about the sort of 7 roles of a health professional that the HPCSA adapted from CanMeds some years ago, and which is reflected in our graduate outcomes. So I just highlight here a paper from Emory University, where medical students were involved in catalyzing climate change education. They explain how they went about doing that. So this was a student-led initiative where they looked at the pre-clinical curriculum and identified the linkages to climate and health context, and then advocated to senior faculty members to discuss how feasible this was and where it could be integrated, how it could be integrated, and what the time commitment would be. So we see here just an example, example from the paper of how they looked at the climate and health learning objectives linked to existing content across the disciplines, and the kind of teaching format ranging from lectures and small group discussions and case-based learning. So that is a good example. It also showed the same university how introducing it for the class of 2024 and spanning it across the organ systems for the first 18 months of medical school helped to establish the essential foundation for longitudinal integration, which, as we know, is important for making sure that our threads are carried through from the preclinical to the clinical years. And then as the convener of the electives program, I'm obviously interested to see that electives as well as the core curriculum is considered for planetary health. And so here are some examples from, again, faculties around the world of how they've provided opportunities for deep exploration. And I see examples in our own context for that. Provide clinical communication skills. So I spoke about the need for health promotion around co-benefits for climate and environment and health. And so this is something that we already include as part of environmental history taking in our health in context and in some of the problem-based cases, but it certainly could be expanded. So this is where it becomes real in the clinical setting. And then I'm pleased to say that our critical health humanities course was cited as an example of situating planetary health teaching in context, particularly for the cases that looks at environmental damaging activities like mining in South Africa, which we know has a huge legacy of poor health. Here again, this links to primary healthcare principles of respect for Indigenous knowledge, their holistic approach, and recognizing that Indigenous peoples who are most impacted often by climate change have a deep understanding of the links between health and environment and the need for ecological balance. And so efforts have been made around the world to reverse some of the effects of colonialism and capitalist exploitation of the environment by bringing these perspectives in. And then equity is centered to our primary healthcare approach. And here again, it relates to how does one address the disproportionate impacts of climate on vulnerable people and strive for greater climate justice. This recommendation relates to the huge environmental impact of the healthcare system that I referred to earlier, and the moves worldwide to move towards more sustainable healthcare. And so I'm pleased to say that Dr. Shrikant Peters has been supervising a number of electives in sustainable quality improvement, to add to the lectures that he gives in Health in Context. And we're exploring with the Western Cape Department of Health additional electives that could give insight into how does one make sustainable healthcare real in our setting. And then mentorship, as we know, is essential. I've been privileged to mentor the group of 5 or 6 students who assisted with this report card. 4 of them are currently in 2nd year, and so we're working with them to take it further, and 1 is in her final year. And we'll see if, my hope is that they will continue to be involved with the curriculum transformation around planetary health. Okay, and then just coming to the domains around student leadership. So the taking it further from just mentoring to actually creating funding opportunities, and obviously means that you can start to promote research and projects that have sustainable impact. And there are some examples of internship programs around the world. And then again, to emphasize the point of partnerships with community organizations around environmental justice. And again, there are plenty of examples, but we need to make that obviously relevant to our setting. Okay, so just to conclude with from UCT's Vision 2030, we have our Planetary Health Vision 2030, which is to say that having undertaken this baseline assessment, we feel that we can repeat, we've identified some priorities for improvement, and that by repeating this, maybe biannually, between 2024 and 2030, we can see how well we're doing in integrating planetary health and sustainable healthcare related learning objectives and outcomes. How well are we doing in creating interprofessional and collaborative educational activities and creating innovative and student-centered assessments, with the outcome of greater graduate agency to protect health from climate change and to build the kind of low-carbon, climate-resilient health systems that bodies like the WHO and Planetary Health Alliance and many others are calling for. We could perhaps also consider annual surveys of graduates and alumni to see whether we are achieving those long-term graduate outcomes. So a final reminder about the importance of this work comes from the 2021 AME consensus statement. That's the Association for Medical Education in Europe, which urges collective action by health professionals to address these pressing global issues while we still have this window of opportunity that is closing fast. And so, as we've heard from leaders around the world, change needs to be happening everywhere all at once, and with great urgency. So I wish to acknowledge my student co-interviewers. You see them listed there. My supervisors, Dr. Lakshini McNamee and Prof. Steve Reed and Prof. Andrea Rother, and then Ms. Carly Hampshire, who's the founder of the Planetary Health Report Card based at the University of California in San Francisco. And then, of course, all our interviewees, some of whom are in this meeting, I'm sure. What has been a follow-up to this for the students has been presenting this Planetary Health Report Card as part of the online conference a couple of weeks ago. And in it, they reflected on what they have gained from their participation. And that includes, as you see there, insights into how curricula are being developed and changed, skills around interviewing and collaboration, and an opportunity to participate in something meaningful. So that is what I will be fostering through ongoing engagement with them. The resources I mentioned, this is the Planetary Health Alliance. So It has over 250 member institutions from over 50 countries. Our institution isn't yet one of them, so that certainly would be a further recommendation. The database that they have created, anyone can browse there. As I say, we can learn from others' experience. And then here, for example, is one from the UK that the Medical Students Council published last year that links climate and ecosystem issues to medical specialties. It looks at the health impacts of the climate and ecosystem crisis, and then outlines the principles for sustainable clinical practice. And then this notion of eco-ethical leadership that I'll be saying more about in the Clinical Ethics Forum on the 8th of June. But how important it is to develop this ethic of sustainability in our professional identity formation. So just to conclude with Bob Mash of the University of Stellenbosch, who's done great things there in embedding sustainability into their curricula and practice, and with Dr. Charlotte Skerens of the Climate Migration and Health Network, we recently published this call for planetary health and environmental sustainability in African health professions education, and it references the SAHI, Special Interest Group on Education for Sustainable Health Care, which we created in 2021 and seeks to build a community of practice around it. So if this is something that you're interested in, please let me know and we'll notify you of upcoming webinars. Okay, so those are some of my references. The literature is growing, and certainly I think UCT has now a baseline that we can build on, and I trust there'll be some questions as to how you can be part of that. So thank you very much. Over to you, Klaus.
Great. Thank you, James. I really, yeah, like you say, each iteration, it feels like there's a movement, and it's so encouraging to also hear the subsequent steps, how dynamic the space is that you find yourself in. Yeah,
that's been very encouraging. Yeah, to know we we're part of a worldwide movement, and there's a great willingness to collaborate and to, particularly given the urgency of the crisis and the opportunity that health professionals have to be leaders for change. And then, of course, within our own university and faculty with the Sustainable Campus Initiative and our curriculum change.
We have a few colleagues online. I'm wondering if there are any comments or queries or questions from the colleagues online, even just reflections about how this work might also impact your own work. We have colleagues who are also working across both the higher education institution as well as in the clinical spaces, and I think, like you've mentioned, also there's some implications to the health system as well, and leadership that's required, and maybe also how we think about clinical governance, how to incorporate a planetary health perspective in our thinking and planning. I wonder if there's someone who wishes to also share some thoughts, or maybe from yourself, James.
Sorry.
Maybe
well, just
also from yourself,
on the governance issues. So within the Western Cape, we have a climate change response strategy that is driven by the Department of Environmental Affairs and Development Planning. At the city level, we have a climate change action plan that is a very well developed and specific one, with a lot of work going into how to create a more resilient city that's better prepared for sea level rise or for extreme weather, and better housing. And then we also have within the Western Cape Department of Health, a climate change forum under the leadership of Dr. Laura Angeletti de Toy, I think it is. She's a chair, and she's a architect by profession and has been involved with design principles around, greener, more environmentally sustainable buildings. And so those principles have been incorporated into some recent facilities like Mitchell's Plain and Khayelitsha and the facility in town, District 6, I think it is. And Groote Schuur and Mitchell's Plain and Victoria and others are all part of the network called the Global Green and Healthy Hospitals Network. That is an initiative of healthcare without harm, probably about a decade old now at least, and lots of inspiring case studies from around the world as to, what does reducing waste, water, energy, pharmaceutical, food, carbon footprints look like in clinics and hospitals. Yeah.
I'm glad you mentioned both hospitals and clinics, because I think, it's also important to really think at clinic and community level how one can incorporate these principles. Yeah. Great. Any thoughts? I see there's also Natasha from the Division of Environmental Health that has also joined us. Welcome, Natasha. It's good to have you here. And I'm wondering also, any thoughts or comments from your side? I know you and James have probably been working very closely as well.
We only recently met, but
Oh,
again,
right.
after remembering Natasha from being her days as a student. But yeah, we look forward to working together more. Hi, Natasha.
Yeah. Hi, thanks, James and Klaus. That was very interesting. I'm looking forward to getting a bit more engaged with this project and planetary health in general at the Division of Environmental Health and just generally the School of Public Health. Yeah, no specific comments at this point.
Thanks, Natasha. So I think for me, a good opportunity is, working with the student group that we have, who, as I mentioned in that poster presentation, really want to build the relationships with invested members of staff. We want to foster interest in sustainability amongst other students, and we want to broaden the potential impact of these scores to say, we've got this baseline, perhaps to be involved in an iteration of this in a couple of years. It could be part of an SSM project, as it was last year. It could be part of an elective. And then in the curriculum review of the PBL cases, for example, we can link these themes to existing content. I referenced the Emory University paper where students with their proposals worked out that it would require less than 0.2% of existing curriculum time, to add lecture slides here and there or to add topics into these small group discussions. And given how tight our curricula are, we obviously need to get eventually to that kind of level of detail to say, how much extra time, what resources, but most importantly, how can we bring the student voice in to make it really engaging and something that is ultimately, driven by them, I think.
Yeah.
Okay. I can also say with the electives, so I mentioned the sustainability quality improvement, that there's a course in the UK run by the Centre for Sustainable Healthcare So for educators in the clinical space who, want to know what sustainable clinical practice looks like, I would really recommend that. And, it again covers the details of how to move from a single-use system like we have to more sustainable use and the kind of products that are now being produced to meet that demand. The NHS, I think, has a goal of net zero by 2040, and other health systems around the world are following suit under the leadership of the WHO. So there's a real driver, for this kind of sustainable product. And our South African Health Products Regulatory Authority, I think, will in time with concerted advocacy start to come in line with growing sustainable practice around the world. That is certainly the hope that I and some other colleagues in Department of Surgery have had with our approaches to the SAHPRA in recent months. Okay.
Great. Any more comments or questions from the colleagues online?
So just to also conclude by saying that with the curriculum change, if you haven't been directly involved in it, we'll shortly have working streams. I think there's 7 or 8 that are being commissioned. And so this is where the real work of curriculum change happens. And so this theme will probably fit into the novel teaching and learning stream, but it obviously also has links to the core curriculum one, to the student-supported learning, and then we need to work out how best to assess it. And so at this stage, I can see that over the next year, I'll be working with others in that stream to develop the learning objectives and activities and assessments that are needed to make it real, and then to evaluate it and to say, are we achieving with these innovations what we hope to achieve?
I mean, that's very exciting. I think also from the curriculum, also think about how that will translate into the graduates, that you're already involving the students and recent graduates in this work. I know, just for interest's sake, there's also a CPD article that is in the process of being finalized for the South African Family Practice Journal, aimed at primary care clinicians on climate resilient primary healthcare practice. So I think that there's a lot of work also in that area, trying to reimagine the existing graduates, but I think importantly for the curriculum work that you're doing and leading is that one looks at how can we prepare our future graduates to be more appropriately able to not only work in the system, but also to influence and lead the changes that are needed. Yeah, so that's really exciting. And I think your concluding remarks were so good to map out the next steps.
Right. No, thank you. It's also good to have allies like Bob Mash and Christian Logotrola at Stellenbosch. So Christian Logotrola is a planetary health lecturer there, and so they've started to, with this year already, bring it into the foundational years. And so through the special interest group and SAHI, we have to build those kind of linkages, because when we did an audit towards the end of 2021, we found not much happening, but growing interest and opportunities being identified as to how this content could be integrated into environmental and occupational health content. And then just last week, I had a conversation with two colleagues in physiotherapy who are driving the Environmental Physiotherapy Agenda 2023 that seeks to bring environmental and sustainability considerations, into their curricula. And that's a worldwide initiative, EPT 2023. And so we'll see where we go with that. So again, Planetary Health offers the opportunity for real cross-disciplinary and interfaculty collaboration. Yeah.
Absolutely. And I'm glad you're bringing the interdisciplinary, the reminder about its importance, the One Health approach.
Exactly. Yeah.
Yeah. Oh, fantastic. I don't see any more comments. So yeah, I think maybe it's good to wrap up at this point. What do you think, James? Yeah.
No, that's fine. I'm happy to. I'm hoping in future to have our students do a presentation to the student body.
Yes.
So as I say, I'll keep mentoring them, and in time to have groups like Green Campus Initiative and African Climate Alliance, more active amongst our student body. If we could get to the situation where, like Emory, we have students challenging the educators to say, we are the generation that are going to inherit the consequences of environmental degradation. We need to be better prepared for it. Then I know we've started to succeed.
Yeah.
So any offers of collaboration are most welcome, and Natasha and I will be taking it forward again also through the Division of Environmental Health.
Fantastic. And I like what you said. I mean, if we can ignite the students to be the agents of change, and also to push for the curriculum change, that would be amazing.
Yeah. So if you have any interested students, put them in touch with us, and we'll link them to the Planetary Health group that we have, and the sort of broader international student movement as well. That's is doing similar work elsewhere.
Okay.
Great, thank you.
That's a great call.
Mm.
A strong place to conclude this conversation, but it's not the end of the all the work that's being done, and it still needs to be done. Yeah, but it's exciting. I think it seems to be a lot of energy, and thank you for mustering up the energy and maintaining momentum, James, with all the work that you do, both locally and nationally and internationally. Yeah.
Thank you, Klaus. Appreciate that. Thanks for the opportunity. Thanks everyone for your interest and attendance. We'll be in touch.
Sounds good. Thank you.
Bye now.
Bye, everyone. There's an excellent applause from Natasha. Thank you, Natasha. Thanks, Stephen. Thanks, Clint.